Hello there, everybody, and thank you so much for joining us today. I'm incredibly excited because today I'm being joined by a wonderful lady who's been with the CMA for a good few years now. Her name is Varsha Khatri. And the thing about Varsha is it's so wonderful to have you here, but it's really fascinating because you have this amazing way of combining two different disciplines, don't you, Varsha? So I was just wondering if you can tell us a little bit about the work that you do.
Yeah, you're right, Janie. First of all, thank you for having me today. But yes, I do. I have a very unique skill set in that I combine both Ayurveda and nutrition together. And both are incredible healing modalities. But when you put them together, it's almost like combining the East and the West, because nutrition is very much a Western approach. Ayurveda, we know, is Eastern as well. But when you put it together in the middle there, it's very unique because they complement each other very well. So I tend to take a lot of the Ayurvedic nutrition advice, and I take the modern science with nutrition as well to help my clients with things like digestion, autoimmune conditions, food allergies. But yeah, both modalities together are just very powerful.
So interesting because I was going to ask you actually about because obviously in Ayurveda there is a whole philosophy of nutrition, isn't there? And so I was wondering how much that Ayurvedic philosophy sort of informs the way that you work with your clients nutritionally.
Yeah, so there in Ayurveda, there's the six tastes, the sweet, sour, salty, pungent, bitter, astringent. And those tastes are primarily used to balance the doshas. And based upon that, we know that a variety of foods help a variety of balancing the different doshas. Now, with nutrition, we also know that different foods have different functions and different balancing effects. So, for example, sweet foods pacify the vata dosha, and the sweet taste is also very healing. But sweet taste isn't just sugar or the sweet fruits and things like that, but it also includes your vegetables, many grains, legumes as well. But those foods are also tend to be often high in antioxidants, which are also can be very healing and therapeutic for the body. So it's finding that common ground between the foods and explaining how they both have the same function, just a different approach to it.
Yeah, absolutely. No, it makes to me it makes complete sense, and I think it's lovely. I love the way that you've created this fusion of East and West in the work that you do, which I think really appeals to so many people. Because I think there are a lot of people I think who are out there who are sort of looking at the more traditional methods because I think people are starting to come to a realization that these traditions exist and have existed for millennia, but, for very good reason. If these approaches didn't work, then they would have died out many, many hundreds of years ago, wouldn't they?
Exactly.
Yeah.
Exactly. Yeah.
But it's also lovely, isn't it? The fact that there is so much research being done, really hardcore scientific research being done in the field of nutrition now as well. So I guess that sort of informs and brings yet another viewpoint, doesn't it, to what you do?
Yeah, absolutely. I mean, you see nutritional therapists or new age, I guess, new age doctors or functional doctors also turn to Ayurvedic remedies like ashwagandha or triphala to help their patients. So
Yes.
you do see the overlap, and there's more scientific studies happening with a lot of these mainstream herbal remedies.
Very much so, yeah, very, very much so. It's interesting, isn't it? I mean, one of the most researched compounds in science, actually, across the board, is curcumin. And of course, coming from turmeric, that amazing, beautiful ingredient that is that yellow color in many curries, isn't it?
Yeah.
What we know about curcumin is just it's a mind, its capacity to heal is absolutely mind blowing. So it's just fascinating, really. I think that we have these things available to us. So in your practice, do you actually work with particular people? Is there a particular sort of core audience, if you like, for the way that you work?
Yeah, so although I do work with children as well, I mostly work with adults who have digestive troubles, diabetes, or autoimmune conditions. So they're often the people they've turned to their doctor, they've turned to other modalities, they're not satisfied, their quality of life isn't improving, and they're really looking for a more holistic approach. And that's why they often get referred to me by a friend, family, or they find me online. But where they tend to come from is that they're stuck. They want a new approach, and I can offer them that new approach.
Yes, yes, that is absolutely fantastic. I think it's great actually because so this is one of the things I think in complementary medicine that we find is that people often come to us as a last resort because they've tried everything else and everything else has failed. And yet, if they could but start off by making those few lifestyle tweaks, they
Yeah.
would have that heartbreaking, kind of hamster wheel of going from one doctor to another consultant to another, and so on. It can just be exhausting and actually just, well, it can be quite heartbreaking, can't it? And
Yeah.
this is my dream for complementary medicine is that the people understand the work that we do, hence doing these sorts of interviews, and they understand that actually because we are such highly trained professionals, that if somebody is turning up with something more serious that does need to be referred to conventional medicine, then that's what we do. We don't keep patients for ourselves. We are highly trained and we know when to refer. And I'm gathering that is something that you would do if you had.
Oh, absolutely. Absolutely. I write letters to GPs. I, refer them on to another specialty if I need to. By all means, I'm not a qualified therapist. I'm not I'm not a doctor. And I know where my boundaries are. And I'm very clear with my clients up front. Like, look, if you need more help, then I can provide. That's the whole point of holistic medicine or holistic health, is that you're not exclusive to just one type of modality. You have to be open to others.
Yes, yes, absolutely. I completely agree with you. And it's very interesting, actually, that if you look at the conventional medical doctors who are really quite high profile on TV at the moment, they are starting to realize that the types of work that we do in our field really bear merit. And actually, the lifestyle approach, nutrition, Ayurveda, and so on, all of these holistic approaches that we offer actually do play a massively important role in public health and well-being. So thank goodness, we're finally starting to see a little bit of light at the end of the tunnel, which is great. So
Yeah,
now I understand that aside from working with your clients, you're also a writer, aren't you?
I am.
Yeah, tell me
I
about your latest book. What's it called?
I'll think healthy, choose healthy. It's been a book, the years in the making, but just published earlier this year in April. And yeah, it takes my years of practice, like my clinical practice. And what I've learned over the years by working with my clients, it comes down to the choices that you make. So whether it's for prevention of disease, so staying in good health, or whether you're trying to heal from any existing condition, it comes down to the choices you make as an individual. So you have to take responsibility for yourself to take good care of yourself as well. And when you see any alternative therapist or even a doctor, it's an initiative more towards self-care as well. And so in my book, I've brought together Ayurveda nutrition, but also shared the holistic approach about what you can do to improve your mental, physical, and spiritual health, how it all integrates, but that it's not an all or nothing approach. We're very much told, or we feel that we're told that you have to, eat this a certain particular way. You have to exercise, you have to sleep X number of hours a night. And what I've done in the book is explain that no, you don't have to do everything, but you start where you can when you're looking to make a change, and then you build upon it. So that way, sometimes the changes in self can be quite overwhelming. So doing too much one go isn't helpful either, and it could have the adverse effect. So I've talked them through my readers through a step-by-step approach, by which by the end you create your own ideal wellness plan.
Yes.
That's not, this is what you do. Because I think a lot of books tell you this is exactly what you do. Whereas I'm very much trying to create self-awareness and create that approach where you can take responsibility for your own health. And this is how you can do it.
Yeah, which I think is wonderfully empowering, actually, because the thing is that it's also kind of contrary, I think, to the patriarchal model of conventional medicine, which is basically, well, do what I said, do what I'm telling you to do. Well, why is that, doctor? Well, because I said so, and that
Yeah.
actually terribly helpful, is it, from a sort of holistic health point of view? Because I think that people are far more intelligent than that, and I think that people do actually like to know why they should be doing X, Y, Z. I don't think we should just expect people to take things on face value. How do you feel about that, Varsha?
Oh, absolutely. Absolutely. So I have a master's in health education as well. And I do believe that when you can educate and tell your clients or your readers why you're asking them to make a change or a choice, they're more likely to stick with it because they understand and they're willing to build upon that. It also helps create trust. But when, yeah, that just do as I say approach, it's more that, when a parent telling off a child and the child just wants to rebel, like, well, I don't have to do that.
Yes.
It becomes that approach. And it's an approach, it's a model that just doesn't work anymore.
Yeah, absolutely. It's really interesting, actually. I remember doing a live TV show. It was one of the sort of daytime TV shows, something like that. And I was on Making the Case for Complementary Medicine. And there was a doctor, a very famous TV doctor on. I shan't name any names, but this was back in the early 2000s. And I was talking about, empowered patients, informed patients are empowered patients, and they do better. The outcomes are better when people are starting to understand why they need to take responsibility for their own health. And the doctor sort of rolled his eyes and said, "Oh," he said, "it's my worst nightmare when an informed patient comes into my practice." Now, thankfully, the tide is changing, but this has been this very, very sort of, I think, very iffy model for a long time. So it's why I'm so happy that you've got an advanced degree in health, in sort of health education. I think that is incredible, and I think that must bring so much to the way that you practice.
Yeah, absolutely. But it's also making sure that people feel educated enough to get information from a credible resource as well. So I also discourage just Google searches and talking to random Facebook groups about,
Yes.
their health questions and things like that. I do stress the importance of going to someone qualified to get the right advice the first time around then.
Yes, yes, absolutely. No, I couldn't agree more. I think you're absolutely right. And this is actually one of the reasons for why we're so proud to have you as a Complementary Medical Association member, because it does give people a repository to find a database of fully qualified practitioners. And obviously very, very, very proud to have you amongst our membership. One of the things I guess we need to explain to people is if they're watching this, for example, on YouTube, underneath this video, there's a little arrow to the right-hand side. If you click on that arrow, it will actually open up the show notes and we'll have all of Varsha's contact details in there for you. So, but Varsha, just for anybody listening in, if they're perhaps listening to this on a podcast or what have you, what is the best way for people to actually be able to contact you?
So there's a few ways. You can do email. So you can do varsha@illuminatedhealth.com. You can go straight to my website, which is illuminatedhealth.com. I'm also on Facebook, Instagram as Illuminated Health. So any Google search of Illuminated Health or even my name, Varsha Khatri, will bring up my website. You can find me on social media. But yeah, on my website also has all my contact details as well.
Fantastic. That's absolutely brilliant. Well, we'll make sure that obviously all of the notes are under the, there's under the video itself, so people will be in no doubt as to how to find you. But and of course, you're on the CMA website as well. So
Yes, of course.
to be found. But Varsha, thank you so very, very much. It's been absolutely fantastic. Your words of wisdom are so appreciated.
Thank you very much, Janie.
Well, no, it's just such a pleasure having you. And I know that your clients are very, very lucky to have you. And thank you for the beautiful work that you do in the world.
Thank you.
Thank you.
Thank you. Thank you for all you do as well.
Pleasure. Thank you, Varsha.